over 60, these 7 hidden symptoms of colon cancer could save your life. Before we begin, have you ever noticed a change in your bathroom habits and thought nothing of it? Have you ever experienced stomach discomfort, unusual fatigue, or unexpected weight loss and simply blamed aging? And have you ever wondered whether your body might be trying to warn you about something serious long before a diagnosis is made? Most people do, and that's exactly why colon cancer remains one of the most dangerous cancers affecting older adults today. Colon cancer often develops slowly and silently. In many cases, the earliest warning signs appear months or even years before the disease is discovered. The problem is that these symptoms are often subtle, easy to dismiss, and commonly mistaken for normal aging, stress, dietary changes, or minor digestive problems. But what if recognizing these signs early could make all the difference? What if paying attention to just a few unusual changes could give you valuable time to seek medical attention before the disease advances? Today, we're going to explore 7 hidden symptoms of colon cancer that many people over 60 ignore until it's too late. As we go through each sign, I want you to think carefully about your own health. Have you noticed any of these changes recently? Have they persisted longer than expected? And could your body be trying to tell you something important? Let's begin with the first hidden warning sign. Number 1, changes in bowel habits. Have you noticed that your bowel habits are no longer predictable? Do you find yourself going to the bathroom more often than usual? Or perhaps you're experiencing constipation that seems to come and go without explanation. Many people assume these changes are simply part of getting older. But are they? And how long have these changes been happening? Colon cancer often begins as small growths inside the colon that gradually interfere with the normal movement of waste through the digestive tract. As a tumor grows, it can partially block the passageway inside the colon. This may lead to persistent constipation. In other cases, irritation caused by the tumor can trigger frequent diarrhea. Some people experience alternating episodes of both. Have you found yourself rushing to the bathroom more frequently? Have your stools become narrower than normal? Have you noticed that your digestive routine simply feels different than it used to? These changes may seem minor at first. However, when they persist for several weeks or continue getting worse, they should never be ignored. Your colon is designed to function consistently. When that pattern suddenly changes, your body may be sending an important signal. And there is another warning sign that often appears alongside these bowel changes. Number 2, blood in the stool. Have you ever noticed blood after using the bathroom? Did you immediately assume it was hemorrhoids? Did you tell yourself it would probably go away on its own? Many people do. In fact, one of the most commonly overlooked signs of colon cancer is blood in the stool. Sometimes the blood appears bright red. Other times, it may be dark, almost black. In certain cases, the bleeding is so small that it cannot even be seen without laboratory testing. Have you noticed streaks of blood on toilet paper? Have your stools appeared unusually dark? Have you experienced bleeding more than once? When a tumor develops inside the colon, it can damage nearby blood vessels. Even small amounts of repeated bleeding can become significant over time. Unfortunately, many older adults delay seeking help because they feel embarrassed discussing bowel symptoms. Others assume hemorrhoids are the cause. While hemorrhoids are common, repeated bleeding should always be evaluated by a healthcare professional, because over time, hidden bleeding can lead directly to the next symptom. Number 3, unexplained fatigue and weakness. Do you feel exhausted even after getting a full night's sleep? Have simple daily tasks started feeling harder than they used to? Do you find yourself lacking energy for activities you once enjoyed? This is one of the most frequently ignored warning signs of colon cancer. When tumors bleed slowly over time, the body gradually loses iron. Eventually, this can lead to anemia. Anemia reduces the amount of oxygen delivered throughout the body. The result is persistent fatigue that doesn't improve with rest. Have you been feeling unusually weak lately? Do you become tired after minor physical activity? Have family members commented that you seem less energetic than before? Many seniors assume this exhaustion is simply a normal part of aging. But aging itself should not cause sudden or severe fatigue. When tiredness becomes persistent and unexplained, your body may be trying to alert you to a deeper problem. And often, fatigue is accompanied by another warning sign that catches many people by surprise. Number 4. Unexplained weight loss. Have you lost weight recently without trying? Are your clothes fitting more loosely than they used to? Have friends or family commented that you've become noticeably thinner? Most people would welcome a few pounds disappearing, but unexpected weight loss is not always good news. Colon cancer can interfere with the body's ability to absorb nutrients efficiently. At the same time, cancer cells consume enormous amounts of energy. As the disease progresses, the body may begin losing weight despite normal eating habits. Have you lost more than 10 pounds without changing your diet? Have you noticed muscle loss in your arms or legs? Do you feel like your body is shrinking for no clear reason? Unexplained weight loss should never be dismissed, especially when it occurs alongside fatigue, bowel changes, or digestive symptoms, because there is another hidden symptom that many people mistake for ordinary stomach problems. Number 5, persistent abdominal pain or cramping. Have you been experiencing stomach discomfort that simply won't go away? Do you feel bloated more often than usual? Have you noticed cramping after meals? Colon cancer can create discomfort in several different ways. As tumors grow, they may partially block the colon or irritate surrounding tissues. This can lead to persistent abdominal pain, bloating, pressure, or cramping. Have you felt a dull ache that keeps returning? Does your stomach feel unusually full even after small meals? Have you noticed discomfort that lasts for weeks instead of days? Many people blame these symptoms on indigestion. Others assume they ate something that didn't agree with them. But persistent abdominal pain deserves attention. Your digestive system should not be causing continuous discomfort. And when abdominal symptoms occur together with changes in bowel habits, they become even more important. Yet one symptom is especially easy to dismiss because it often feels harmless. Number 6. A feeling that the bowel never fully empties. Have you ever gone to the bathroom and felt like you still needed to go afterward? Do you frequently feel incomplete relief after a bowel movement? Have you found yourself returning to the bathroom shortly after finishing? This unusual sensation can occur when a tumor develops in the lower portion of the colon or rectum. The growth creates pressure and may trick the body into feeling that waste remains inside even when the bowel is mostly empty. Doctors sometimes refer to this sensation as tenesmus. Have you experienced this repeatedly? Has it been happening for several weeks? Do you constantly feel the urge to use the bathroom even when very little comes out? Many people never mention this symptom to their doctor because it seems too minor, but persistent feelings of incomplete emptying can be an important clue, especially when combined with changes in stool shape, bleeding, or abdominal discomfort. And there is one final symptom that often appears as colon cancer advances. Number 7, persistent loss of appetite. Have you stopped enjoying meals the way you once did? Do you feel full after only a few bites? Have you noticed that food simply doesn't seem appealing anymore? A healthy appetite is one of the body's natural signals that things are functioning properly. When appetite suddenly declines without explanation, it can indicate an underlying health problem. Colon cancer frequently affects appetite through several mechanisms: digestive changes, inflammation, pain, and the body's response to cancer can all contribute. As a result, many patients begin eating less. Have you been skipping meals recently? Do you feel full unusually quickly? Have you lost interest in foods you previously enjoyed? Loss of appetite often develops gradually. Because it happens slowly, people may not recognize the change until significant weight loss has already occurred. When appetite changes persist, they deserve careful attention, because your body may be trying to communicate that something is wrong. So let's review. Have you noticed persistent changes in bowel habits? Have you seen blood in your stool? Have you experienced unexplained fatigue, unexpected weight loss, persistent abdominal discomfort, a feeling that your bowel never completely empties, or a loss of appetite that doesn't make sense? Any one of these symptoms may have a harmless explanation, but what if several of them are happening at the same time? What if they've been present for weeks or even months? And what if your body has been trying to warn you all along? Colon cancer is often highly treatable when detected early. The challenge is recognizing the warning signs before the disease has advanced. That is why awareness matters. That is why paying attention matters. And that is why conversations like this can save lives. If you are over 60, don't ignore persistent changes in your health. Talk to your doctor. Ask questions. Seek answers. Because the earlier colon cancer is found, the greater the chance of successful treatment. If this video helped you better understand the hidden symptoms of colon cancer, please subscribe, turn on notifications, and share it with someone you care about. And before you leave, ask yourself one final question. Could your body be trying to tell you something today that you shouldn't ignore until tomorrow?